Okay, here's something that might surprise you to kick things off. Nasal tumors, they actually make up less than 2% of all tumors in dogs.
Wow, really? That low?
Yeah, and even lower in cats under 1%. Seems tiny,
It
right?
really does, like a footnote almost.
Exactly. But, within that small percentage, there's a really significant health issue. So today, we're doing a deep dive into one specific type, nasal adenocarcinoma in dogs and cats. We're drawing from a pretty detailed medical text here.
And it's interesting, like you said, even though the overall number is small, when these nasal tumors do happen, adenocarcinoma is, well, it's a major player.
Right.
Yeah, the source we looked at points out that for dogs, it's almost a third, like 31.5% of all nasal cancers. That's substantial.
Definitely not a footnote then.
Not at all. And for cats, it's basically tied with lymphoma for the most common type. So yeah, really significant for both.
So the idea here isn't necessarily that, your pet will get this, hopefully not, but understanding how vets figure these things out, the challenges, the treatments, it gives you real insight into veterinary medicine.
Mm-hmm. It maybe helps you spot subtle things earlier, potentially.
Exactly. So think of this as our attempt to boil down the key info, what it is, the signs, the options, without getting totally lost in medical jargon.
Sounds good. Where should we start?
Let's start right at the beginning. What is nasal adenocarcinoma?
Okay, so simply put, it's a malignant cancer. It starts in the lining of the nasal cavity, the nose passages, and also those air-filled pockets in the skull, the paranasal sinuses.
Malignant meaning it's invasive, right?
Precisely. That's the key characteristic. It doesn't just sit there. It progressively invades the tissues around it. Think local bone, other sinus structures, that sort of thing. It's driven by these cancerous epithelial and glandular cells just growing out of control.
And that invasion, it's not just a local problem, is it? It can cause effects elsewhere, more than just a stuffy nose.
Absolutely. The most obvious impact is on the respiratory system itself. You'll see things like persistent congestion, maybe a physical blockage, making it hard to breathe.
Dyspnea, is that the term?
Dyspnea, yes.
Yeah.
Difficulty breathing. Also, recurring nosebleeds, epistaxis, and that persistent, often thick, pus-like discharge. We call mucopurulent discharge.
Ugh, okay.
But because the nose is so close to everything else in the head, well, sometimes the nervous system gets involved.
Like seizures?
Potentially seizures, yeah, or even just changes in awareness, like seeming kind of out of it. And then the eyes, because they're right there too, you might see bulging.
Exophthalmos.
Exophthalmos, exactly. Or just excessive tearing epiphora. So it really can affect multiple systems.
Wow, okay, so it starts in the nose but really branches out. Now,
Yeah?
you mentioned who gets it, dogs versus cats, but what about like age or breed?
Yeah.
And that urban thing you mentioned earlier.
Right, the urban connection is interesting. It was reported more in urban areas. Why? Well, we don't know for sure, but it definitely suggests environmental factors might be playing a role.
Like pollution.
Could be pollution, could be other things common in cities. It's still being looked into. But generally, this is a disease of older pets. Median age is around 10 years for dogs, maybe a bit older, 13 for cats.
In breed. Size.
In dogs, yeah, it seems more common in medium to large breeds. And there's this interesting point in the source about head shape, possibly more risk in dogs with those longer noses.
The leukocephalic.
That's one. The leukocephalic breeds. Again, maybe more surface area inside, maybe something else, but it's a noted potential factor.
Fascinating. So for owners listening, what are the signs they should watch out for, especially the early stuff that might be easy to miss?
Yeah, the onset can be subtle. Often it starts with those intermittent nosebleeds we mentioned, or that discharge.
The mucopurulent stuff.
Right. And here's the tricky part sometimes. Those early signs seem to get better with antibiotics.
Oh, so you might think it's just an infection.
Exactly. And that can delay getting the real diagnosis. The source actually mentions this pattern can go on for like a median of 3 months.
Wow. Okay, what else?
More sneezing than usual, maybe some noisy breathing, sometimes that funny reverse sneezing sound.
Yes, the inward snorting thing.
That's it. As things progress, you might notice more open mouth breathing, which isn't typical unless they're hot or just exercise hard. Bad breath halitosis can pop up too. And especially in cats going off their food, anorexia is quite common.
And seizures you mentioned, but that's later stage.
Usually, yes, if the cancer spreads or presses on the brain, but it's a possibility.
Okay. So if an owner sees some of these signs and goes to the vet, what might the vet find during the actual physical exam?
Well, the exam findings often back up the history. The vet will likely see that discharge, bloody or mucopurulent. They'll definitely check airflow through each nostril.
How do they do that?
Usually just holding a small mirror or even a thin piece of tissue under the nose to see if it fogs up or moves. A big decrease in airflow on one side is a red flag. Sometimes you can actually see facial changes. Maybe a slight bulge over the nose or under the eye, or that eye bulging we talked about, excessive tearing. Gently pressing on the nose or sinuses might cause pain. Even opening the mouth can sometimes be uncomfortable for them.
Okay. And lymph nodes.
Yeah, they'll check the lymph nodes under the jaw and around the neck. Swollen nodes aren't super common early on, but it's something they look for. And rarely, maybe some neurological signs, but that's less typical on a basic exam.
It really sounds like piecing together a puzzle. So let's talk causes. Do we know why this happens? Any specific genetic links or known environmental triggers beyond that urban possibility?
The exact why is still, being researched.
Yeah.
But the source does point to a few things. We mentioned the long head shape in dogs.
The dolichocephalics.
Right. That seems to predispose them.
Yeah.
Genetically, there's some link to mutations in a gene called P53.
What does P53 normally do?
It's a tumor suppressor gene. Basically helps control cell growth and stop cancer from forming. So if it's mutated, that control is lost.
Okay.
Also, something called KEOX2 overexpression. KEOX2 is an enzyme involved in inflammation, and having too much of it might help the tumor grow.
Interesting. And risk factors, you mentioned urban areas. Anything else concrete?
Well, the urban environment link comes up again, suggesting pollutants or carcinogens. And importantly, the source does mention secondhand smoke as a potential risk factor.
That's a big one for pet owners.
It really is. Just highlights how our environment impacts our pets, too.
Definitely food for thought. Okay, so the vet suspects it based on signs and the exam. How do they nail down the diagnosis? You said the signs overlap with lots of things.
Yeah, that's the challenge. The list of possibilities, the differential diagnosis is pretty long. Could be other kinds of tumors, could be infections.
Like fungal infections. I hear those can be nasty in the nose.
Fungal, bacterial, even viral in cats. Could be parasites like nasal mites. Could be something stuck up there like a grass seed. Trauma, bad teeth. Even clotting problems or high blood pressure can sometimes cause nosebleeds.
Wow, okay. Lots to rule out.
Absolutely. Which is why a thorough workup is key. Basic blood tests and urinalysis. Often surprisingly normal.
Really?
Yeah, unless there's been a lot of blood loss causing anemia. Sometimes looking at cells smeared on a slide cytology can give clues, especially if you can easily get a sample.
But that's not definitive.
Not usually. For the real picture, you need imaging. And standard x-rays. They're just not that helpful here.
Not sensitive enough.
Exactly. They might show some general cloudiness or bone changes, but they lack the detail. The source is clear. CT or MRI are really the way to go.
Okay. Why are they so much better?
They give incredibly detailed cross-sectional images. You can see the tumor's exact size, where it's growing, and crucially, if it's invading nearby structures, like that important bone.
The cribriform plate. Between the nose and brain.
That's the one. Knowing if it's breached is critical for prognosis and treatment planning. You can also see if it's affecting the orbits, the eye sockets. This detailed imaging is absolutely vital.
And you'd also check the lungs.
Yes. Usually do chest x-rays, thoracic radiographs to check for metastasis spread to the lungs. Thankfully, that's not super common at the initial diagnosis, but you have to check.
Okay, CT or MRI gives the picture, but the final confirmation comes from?
A biopsy. Got to get a tissue sample.
How's that usually done? It sounds tricky up in the nasal passages.
It can be. Often it's done using rhinoscopy.
Or a camera.
Yeah, a small scope, often flexible, goes up the nose. The vet can see inside, identify suspicious areas, and take targeted biopsies.
Okay.
Other ways exist too, sometimes guided by the CT or MRI findings if direct visualization is hard. Things like suction biopsies or even flushing techniques to collect cells. And if those lymph nodes felt enlarged.
I see them too.
Definitely. Need to know if the cancer has spread there. Then the pathologist looks at the tissue, confirms it's adenocarcinoma, and that gives you the definitive answer.
Right. So, okay. Diagnosis confirmed, nasal adenocarcinoma. What are the treatment options? What's the main approach?
The source is very clear on this. Radiation therapy is really the standard of care. It's the primary treatment.
Okay. And are there different kinds of radiation?
Yes. Broadly, two main approaches. There's definitive or curative intent radiation. That's a high total dose given over many sessions. The aim is to kill the tumor or shrink it significantly for long-term control.
And the other?
Is palliative radiation, lower dose, fewer sessions. The main goal there is symptom relief, reducing pain, easing breathing, improving quality of life, rather than necessarily aiming for a cure.
I see. And are there newer techniques?
There are. Things like IMRT, intensity modulated radiation therapy, and stereotactic radiation. These are more advanced ways to shape and aim the radiation beams very precisely at the tumor.
So less damage to surrounding healthy tissue.
That's the idea, yeah. Potentially fewer side effects.
What about surgery or chemo? Do they fit in?
Well, surgery alone,
Mm-hmm.
generally not very effective for this cancer.
Why not?
Because these tumors are so invasive microscopically, it's just really hard to get it all out surgically. The source suggests regrowth often happens within about 6 months if surgery is the only thing done.
Not great.
No. Now, sometimes surgery might be considered after radiation, maybe to clean up any remaining tumor, but that's complex and carries risks. Chemotherapy. It's not usually the main go-to for long-term control here.
But sometimes used.
It might be an option if radiation isn't possible for some reason, maybe other health issues or cost or logistics. There are drugs used.
Like cisplatin.
Only in dogs, though, right? I remember hearing that's toxic to cats.
Absolute critical point. Cisplatin for dogs only, never cats. For both, you might consider drugs like carboplatin, doxorubicin, maybe an anti-inflammatory like piroxicam. There's also a targeted drug, discernine phosphate.
Palladia.
Yeah. It's shown some promise and is being looked at, sometimes combined with radiation too. Research is ongoing there. So lots of factors in deciding the best path. What about just managing symptoms and side effects, especially during radiation? What supportive care is needed?
Oh, supportive care is crucial. During and right after radiation, pets can get mucositis inflammation inside the mouth and nose.
Making it painful to eat.
Exactly. So things like feeding soft, really tasty food are important. Maybe gentle mouth rinses with saline or even diluted black tea, sometimes suggested. Pain relief is key, of course.
Is that usually temporary, the mucositis?
Yes, typically peaks a week or two after radiation finishes, then resolves. Activity restriction is usually advised too. Less running around helps minimize nosebleeds or breathing issues. And using a harness instead of a neck collar is a good idea.
Avoid pressure on the throat area.
Right. Maybe some diet tweaks too, like avoiding very hot or cold food if their mouth is sore.
Okay, so the big question for owners, prognosis. What are we realistically looking at? With treatment, without treatment?
Yeah. It's tough news without treatment. The prognosis is generally poor. Median survival is often quoted around 2 to 6 months.
Oof. But radiation makes a difference.
A significant difference, yes. With radiation, the median survival times jump up considerably. For dogs, maybe 12 to 18 months. For cats, maybe 12 to 20 months.
So buying significant quality time.
Absolutely. The source gives 1-year survival rates anywhere from, say, 20 to nearly 60%, and 2-year rates maybe 20 to almost 50% for both dogs and cats getting radiation.
Are there things that make the prognosis worse?
Yes, definitely. If that imaging shows the tumor has already invaded the cribriform plate or is involving the brain itself, or if it's already metastasized, those are negative prognostic factors. The outlook is poorer then.
Understood. And what complications should people be aware of, either from the cancer or the treatment?
Well, the disease itself can obviously lead to worsening breathing problems, more severe nosebleeds, maybe secondary bacterial infections in the nose. Weight loss and lack of appetite are common too.
And from treatment?
Treatment side effects are possible. Radiation can cause that temporary mucositis we discussed. Chemotherapy, if used, can have its own side effects like stomach upset or effects on blood cells. One potential long-term thing after radiation is chronic rhinitis. Basically, persistent inflammation and maybe discharge.
So ongoing management might be needed?
Possibly, yeah. And eye issues.
Yeah.
Historically, radiation could cause problems like dry eye or cataracts, but with the newer, more targeted techniques.
Less common now.
Much less common and generally less severe, yes.
Okay, so let's try and wrap this up. If we were to boil down the key takeaways from this deep dive on nasal adenocarcinoma, what would they be?
I think, number one, it's serious, but thankfully not incredibly common overall. Two, the early signs can be subtle and mimic other things, so diagnosis can be tricky.
Right, needs that thorough workup, especially advanced imaging.
Exactly. And three, radiation therapy really is the cornerstone of treatment and offers the best chance to extend life and maintain good quality of life.
Yeah, and diving into the specific condition, it really it highlights just how complex veterinary medicine can be, doesn't it? The diagnostics, the treatment planning.
It really does. And underscores how important it is for owners to be observant, Noticing those small changes can make a difference.
Definitely.
And it makes you think, too. We've talked about the challenges with this cancer, but the progress being made in vet oncology, Better imaging, more precise radiation, targeted drugs like Palladia,
Yeah,
it offers real hope.
that's a great point. It leaves you wondering.
Yeah, what other tricky diseases in our pets might see similar breakthroughs soon? Where else could these advancements take us in improving their lives? Something to think about.